Welcome to another practice question video. At the end of the video, visit the website to sign up for free daily NCLEX questions and free bonus nursing printables. Now, let's begin. Starting with question 1. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid using oil or cream-based soaps, flossing between the teeth, the intake of salt, using an electric razor. The correct answer is flossing between the teeth. The client who is immune suppressed and has bone marrow suppression should be taught not to floss his teeth because platelets are decreased. The nurse is changing the ties of the client with a tracheostomy. The safest method of changing the tracheostomy ties is to apply the new tie before removing the old one. Have a helper present. Hold the tracheostomy with the non-dominant hand while removing the old tie. Ask the doctor to suture the tracheostomy in place. The correct answer is apply the new tie before removing the old one. Leaving the old ties in place while securing the clean ties prevents inadvertent dislodging of the tracheostomy tube. The nurse is monitoring a client following a lung resection. The hourly output from the chest tube was 300 milliliters. The nurse should give priority to turning the client to the left side, milking the tube to ensure patency, slowing the intravenous infusion, notifying the physician. The correct answer is notifying the physician. The output of 300 milliliters is indicative of hemorrhage and should be reported immediately. The infant is admitted to the unit with tetralogy of fallot. The nurse would anticipate an order for which medication? Digoxin, epinephrine, aminophylline, atropine. The correct answer is digoxin. The infant with tetralogy of fallot involves 4 heart defects, a large ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. He will be treated with digoxin to slow and strengthen the heart. The toddler is admitted with a cardiac anomaly. The nurse is aware that the infant with a ventricular septal defect will tire easily, grow normally, need more calories, be more susceptible to viral infections. The correct answer is tire easily. The toddler with a ventricular septal defect will tire easily. The hole occurs in the wall that separates the heart's lower chambers, ventricles, and allows blood to pass from the left to the right side of the heart. The oxygen-rich blood then gets pumped back to the lungs instead of out to the body, causing the heart to work harder. The nurse is monitoring a client with a history of stillborn infants. The nurse is aware that a nonstress test can be ordered for this client to determine lung maturity, measure the fetal activity, show the effect of contractions on fetal heart rate, measure the well-being of the fetus. The correct answer is measure the fetal activity. A non-stress test determines periodic movement of the fetus. A client with clotting disorder has an order to continue lovenox, Enoxaparin, injections after discharge. The nurse should teach the client that lovenox injections should be injected into the deltoid muscle, be injected into the abdomen, aspirate after the injection, clear the air from the syringe before injections. The correct answer is be injected into the abdomen. The method of administration is subcutaneous. The nurse has a preop order to administer valium, Diazepam, 10 mg and phenergan, Promethazine, 25 mg. The correct method of administering these medications is to administer the medications together in one syringe. Administer the medications separately. Administer the valium, wait 5 minutes, and then inject the phenergan. Question the order because they cannot be given at the same time. The correct answer is administer the medications separately. Medications should not be mixed in one syringe unless indicated by the physician. A client with frequent urinary tract infections asks the nurse how she can prevent the recurrence. The nurse should teach the client to douche after intercourse, void every 3 hours, obtain a urinalysis monthly, wipe from back to front after voiding. The correct answer is void every 3 hours. Voiding every 3 hours prevents stagnant urine from collecting in the bladder, where bacteria can grow. Which task should be assigned to the nursing assistant? Placing the client in seclusion. Emptying the Foley catheter of the preeclamptic client. Feeding the client with dementia. Ambulating the client with a fractured hip. The correct answer is feeding the client with dementia. Of these clients, the one who should be assigned to the care of the nursing assistant is feeding the client with dementia. Well, that's it with this video. See you next week for another set of questions. Thanks for watching.